Dr. Aarti Agarwal, thank you so much for being with us on ITV Gold. I hope you're doing well today.
I am. Thank you so much for having me.
Of course, we have to have you because there's so much happening in the nation with coronavirus, and it's important for us to reach out to our community and really give that information out. So let's begin this interview looking at some numbers that are coming in. Today, Dr. Agarwal, we have crossed a grim milestone of 500,000 deaths, 500,000 deaths in this country. We are hearing right now that there is a downward trajectory of cases and deaths. However, this number is so large. How are you looking at it? And how do you respond to such large numbers?
So it certainly is a grim milestone. It's not something that's unexpected based on the trajectory that we have been on so far. The good news is that cases are indeed decreasing at this point. Deaths also tend to lag behind by 2 to 3 weeks because of the long incubation period for this infection, as well as the long duration of illness. So I'm hoping that we're going to see even more of a significant decrease. The increase that we saw since November was really, due to the winter and the holidays, with more people congregating indoors. But currently, with more consistent messaging about masking, and also, the fact that vaccines started being distributed in December, I think will be contributing to a downward trend.
Right, but this brings me to a very important question in terms of the cases and deaths. Are you concerned about the variants right now? And do you think they can cause a fourth surge of coronavirus in this country? How are you looking at the UK variant versus the South African variant?
So the variants definitely are concerning, and I think that the variants are really the wild card, in this equation. So as far as the UK variant, studies right now have shown that it's approximately 50% more infectious than other common variants. Also, it's associated with a higher risk of hospitalization and death. And unfortunately, in the United States, we are seeing that about the cases of the variants are doubling every 10 days. So the UK variant is really, making its mark in the US at this point. The good news about that, though, is that we are seeing that currently the vaccines that are currently available do seem to be effective against the UK variant. Now, when it comes to the South African variant, it's a little bit of a different story, where the South African variant also is present in the United States. However, some preliminary studies are showing that it's possible that there is some decreased efficacy. The vaccines are a little bit less efficacious against the South African variant. So that is a bit concerning for us.
Right, you are an epidemiologist, so I just want to ask you a follow-up question on that. What exactly is this variant doing to the coronavirus that already exists?
So it's basically a mutation. So all of the viruses, have the ability to mutate, and so the issue with all of these variants is that the vaccines are really targeting the spike protein of this virus, which is a commonality. However, if some of parts of that spike protein, or enough parts of that spike protein, are altered in some of these mutations, then the vaccine is not going to be as effective.
Right, and only time will tell how many boosters we would need with these variants coming in. Doctor, when you're looking at the current surges in some states that where we still continue to see cases go a bit higher, we're hearing from experts that a lot of this current surge that we're seeing, or current number of cases we're seeing, has to do with young adults from the age of 20 to 46. How are you looking at that age group? Are they truly responsible for increase of cases?
So I wouldn't want to blame one age group for a surge in cases, but it is true that about almost 40% of the total cases in the United States have been among people ages 18 to 39. And there are probably several factors that contribute to this. So they are more likely to engage in some riskier behavior, like congregating indoors. But on the other hand, there are many of these people who are also essential workers that are more likely to get exposed to the virus at work or using public transportation. And just generally, more likely to be outside of the home working. So I think that's multifactorial.
Definitely. Doctor, let's now talk about the vaccines because we have a lot of questions on that. My first question in regards to the vaccine has to be, have you seen any difference in side effects between Moderna and Pfizer? These are the two vaccines that are being administered in the US right now. How have you looked at these two vaccines, and what insight could you give us about that?
So both the Moderna and Pfizer vaccines, they have a very similar mechanism, and so the side effect profiles are very similar for both vaccines. Generally, people have fatigue, headaches, muscle aches, joint pains, things like that after taking the vaccine. For both of these vaccines, people generally have more side effects after the second vaccine rather than the first. However, it is important to note that if you did have a COVID infection previously, you are more likely to have side effects after you receive the first dose. Overall, again, there's not that much difference between the two. There is a little bit of difference in the anaphylaxis rates. So anaphylaxis is slightly higher with the Pfizer vaccine at 6 cases per million on average, and about only 2 events per million for the Moderna vaccine.
Right. What's your take on the Johnson & Johnson vaccine, doctor? I'm seeing that it is one shot only. However, its efficacy is about 66%. Should this be distributed in the US, and can that change the game of the slower rollout of the vaccine? Two-part question.
Absolutely. So the first part, it's really important to note that as far as vaccines are concerned, the threshold for efficacy is actually 50%. So a lot of the common vaccines that we currently take, like the flu vaccine, in an average year, the efficacy is going to be between 50 to 60%. We are really fortunate that we have, with the Pfizer and the Moderna vaccines, such an incredibly high efficacy, but that's not the usual case with vaccines. So even though it seems like the efficacy is low for the Johnson & Johnson vaccine, it's still significant. So the bottom line is yes. I definitely feel that the Johnson & Johnson vaccine, the rollout will be much quicker. And there are 2 reasons for this. One is that it's only a single shot. So you can have much more of the population immunized in a much shorter amount of time. And secondly, there's no requirements for the cold chain. That means, the cold storage that is necessary for the Pfizer vaccine and for the Moderna vaccine. And so the distribution can be much broader. So it can be, given to primary care doctor offices, pharmacies and urgent care centers, churches, other places where people will, be able to, go to more easily and access vaccine.
Right. While talking about vaccine, another one that's really making the news is the AstraZeneca vaccine. It has been approved by the WHO, the World Health Organization. However, as we were discussing a little bit earlier, due to the South African variant, South Africa has stopped its administration. How are you looking at AstraZeneca? What is the chance of it getting approved in the US?
So there's actually new promising data that just came out this week about the efficacy of this vaccine that came out of Scotland. So they did see that hospital admissions were reduced by about 94% in the vaccinated group. It's really difficult to know how long immunity will last until we have more data. The reason that the WHO stopped this trial in South Africa is that it really seemed like the AstraZeneca vaccine was not very effective against the South African variant. So I think they were reaching thresholds of about 25%, which is really not enough to approve a vaccine.
Doctor, when you're looking, go ahead. Go ahead, Seth.
No, I was just going to say that similarly, there are other vaccines, such as, the Johnson & Johnson vaccine and the Novavax vaccines that were also tested in South Africa that had a reduced efficacy in that population compared to the clinical trials they did in other countries.
When you're looking at the vaccine research, doctor, what is still missing? What is still concerning epidemiologists such as yourself?
I think the big question for me is that, it's still not known whether, after you receive the vaccination, are you still able to transmit the virus and infect other people, even if you're asymptomatic? I think that this would be a really big step in being able to ease the current social distancing requirements and masking requirements and really get to some sense of normalcy. So until we really have good data to establish, the transmission of the virus after vaccination, we're not really going to be able to ease up on some of those regulations.
Right.
The other big question for me, I think, is how long will immunity last with these vaccines?
Right. And just talking about those immunities, doctor, certain experts are saying that they can guarantee immunity for about 90 days after taking this vaccine. Your comments on that?
So that's just really because of the data that we have available. So we can only comment on, what the current data, indicates. And because we started rolling out these vaccines, just in December, we haven't been able to collect data for long enough to really determine how long it's going to last. In addition, if the variants kind of take over the current, COVID virus that's circulating in the United States, that really may change the efficacy that we're seeing for the current vaccines that are available.
Right. Doctor, when you're looking at people that have been vaccinated already, a big question that's coming out is what can they do after they have been vaccinated? Could grandparents visit their grandchildren at this point if they have been vaccinated? Could you, go away with wearing a mask? Could you travel more easily if you're vaccinated? How do you look at those individuals?
So after you're vaccinated, it's really important to know that you're really only immune after, you're 2 weeks out from your second dose. And then you can consider yourself immune for at least, a period of 90 days. And so there have been some regulations that have been eased up, such as quarantine regulations. So if you are vaccinated and you're in that period of you're 2 weeks out, but you're still within 90 days of receiving the vaccine, you do not have to quarantine anymore if you're exposed to a COVID positive person. So that's really been a big change in policy. But right now, we're still recommending that you still continue to social distance. You still continue to, wear a mask when you're in public, or really not amongst your regular, household members. So we're still encouraging, everyone to not let down their guard and really still continue to be careful, especially when you're around people who are high risk.
Right. And just talking about the mask, Dr. Anthony Fauci, one of the nation's leading health experts, actually stated that Americans may be wearing masks up until 2022. Your comments on that, and also how important do you think is double masking right now?
So I do think that with the variants emerging and questionable, vaccine efficacy with those variants, it is, I think that it's prudent to continue wearing a mask. I really don't think that there's any harm in it, and that it can only protect, yourself and others from being infected. So I do think that, Dr. Fauci is correct in his prediction that we are going to be continuing to wear masks for quite some time. As far as double masking, you can do that to be more careful. I think what is really important is making sure that you're wearing a mask that fits snugly on your face. So you want to have a good seal on your mask, and double masking can certainly be effective if you want to wear a disposable mask and then a cloth mask, over it. It will provide more protection. I think that what they've seen is that some of the cloth masks that have been that people have been using are not necessarily as effective as using a mask that has a little bit more protection, or more layers.
Right. And it's so, again, important for all our viewers to wear your mask and follow those 3 guidelines of social distancing, hand washing, and wearing a mask. Another big issue, doctor, concerning vaccination is actually a debate about schools opening. The CDC has said that the schools can safely open up even without vaccinating the educators and the teachers of that school. A lot of teachers and educators are concerned about it because so far they've been trying to keep themselves safe, and they can, get the virus from the children, or it could be transmitted across the school. How are you looking at this? What advice could you give to these individuals? And also, what advice could you give to just general public on this?
So, as far as school opening, schools can be safely opened as long as they're implementing mitigating strategies such as masking, social distancing, all of the other things like contact tracing, cohorting, to reduce transmission in that community. What we've seen so far is that transmission within schools has been very, very low for those schools that have opened. Now, I do think that teachers and school staff and faculty should be prioritized for vaccination, but I don't think that they all need to be vaccinated prior to opening school.
Right. What is your take on domestic travel, doctor? I know the administration right now is trying to make a pathway where perhaps everybody traveling should be vaccinated and they have to show that proof. How do you think that could affect, coronavirus across the nation?
So currently, I don't think that we can require people to be vaccinated to travel just because it's not available to all adults. So domestic travel can occur with the current precautions in place, such as masking, hand hygiene, social distancing. In some cases, some states may require testing, as they have, and quarantine if you're coming from an area of high transmission. But once vaccination is more widely available, I think that we can think a little bit more deeply about those types of policies being implemented.
I just have 2 more questions left here for you, doctor. The first question has to do with South Asians at high risk. We've seen it throughout this pandemic that South Asians have been impacted by this disease. Other communities of color also have been impacted by this disease a little bit more. What is your advice to South Asians at high risk right now? And how concerned are you about the interaction between these comorbidities and COVID-19?
So certainly many South Asians are at high risk for COVID-19 and really the severe outcomes due to the high prevalence of diabetes, hypertension, and other chronic diseases. So my advice to them, again, is really to not let down your guard right now. Continue to social distance, wear your mask when you're out in public, hand hygiene, just those basic things that we've been doing. I feel like there's a lot of COVID fatigue out there. I think everyone is really feeling that. People want to travel, people want to, really see their extended families and such. But, my advice is to, continue taking precautions, get vaccinated when you're eligible and when vaccine is available to you. However, I would say, don't delay seeking medical attention if you need it, and maintain caring for your chronic illnesses and seeking preventative care as well. It has been a whole year that we're into this pandemic, and so we can't continue postponing or delaying care. It's really important that you continue to take care of yourself.
Right. And finally, my last question to you, doctor, I wanted to ask you, as a doctor and as an epidemiologist, what is your biggest concern right now? And what is the biggest advice you could give to the public?
My biggest concern, I think, is really about the variants that may be emerging. I think that everyone is really hopeful that between the vaccines that are available and even these monoclonal antibodies that are available for treatment of non-severe disease, there seems like there's light at the end of the tunnel, which I really hope that there is. But I think my greatest concern is really these emerging variants and how that's going to shift what we're seeing as far as cases, and whether there may be another surge of coronavirus coming our way. But I'm really hoping that the vaccines will continue to be effective against these strains, and that we'll be able to get things under control very soon.
Right. Well, Dr. Aarti Agarwal, thank you so much for your time here on ITV Gold. I look forward to having you again on our show.
Thank you so much.